Hi, this is Patty Hodge, and this is Dr. Nurse's Rock. This video is part of a series of videos on the topic of grief that we're presenting on this channel throughout the month of April. And today I have a very special guest again for you. Dr. Baugher is a fellow in thanatology, and he recently retired as a psychology professor from Highline College in Des Moines, Washington, where he taught courses in psychology and death education. As a trainer for LivingWorks, he has trained more than 1,500 people in suicide intervention. Dr. Baugher has written grief-related books and articles and has given more than 900 workshops on coping with grief. He is the professional advisor for both Seattle Widowed Support Group, Widows Information and Consultation Service, and the South King County chapter of the Compassionate Friends. You can visit his website, and I will put a link below for you to find his works. Welcome to you, Dr. Baugher.
Thank you, Patricia.
It's good to see you. I found you because I was looking for information about this thing called proxy grief. And I was hoping that you could explain to us what that is and what we might do about it.
Okay. Yeah, I kind of came up with that term years ago, and then as I read things. I wasn't the only one who came up with this term, but basically, when a loved one dies, we have our own grief reactions, all these complex issues that affect our mind, our emotions, our body, our spirituality, and so on. And so grief is bad enough. But then when we watch our loved ones grieve, that's proxy grief. And so on top of our grief, we got this, we worry, and especially parents who've experienced the death of a child, they're watching their other children, and quite often if they're 10 years old or 20 years old or older, they are these young ones are concerned about their parents, so they're not going to show their parents all their all the grief that they're experiencing. They're worried about their parents, so the parents are worried. So I've never had, one of the first articles I wrote years ago was called "What If I Grieved Perfectly?" Because I've never had, a person coping with grief come up to me and say, Dr. Bob, I'm grieving just right. I'm crying just the right amount of tears, and I've just got the right amount of anger and so on. It's like, and what I always say to them is, you grieve however you're going to grieve, and don't have some expectations. And especially if you have children who've experienced the death of a grandmother, a parent, or a sibling, you're not going to see all of their grief, so you're going to worry about them, and that just adds on to your own level of grief called proxy grief.
Well, I'm no stranger to that. And I'm glad to know that there's a name for it because it sort of helps to contain it if we know there's a name available. Um, so you have worked with so many people, and this is such an impressive biography that you've got here. What what do you advise people to do if they're experiencing this kind of worry and anxiety around a family member or somebody they love? Um,
Yeah.
yeah.
Yeah, good question. Let me start with a larger way of looking at it. One of the workshops that I've given over the years is a workshop on worry. And the first thing I say to the people attending is I say, I'm not going to tell you not to worry, but I'm going to give you some suggestions for how to worry effectively. Okay. And so, and as it is with, coping with proxy grief, you write down all your worries. One of the things that, the fact in psychology that no one disagrees with is that when you keep it in here, it just goes round and round and round. The important thing is to get it out, write it out, talk it out to somebody, do it in your voice recorder, whatever it is, get it out, so you can see it. And so list all your worries. Okay. That's number one. Second is find a place to worry. That is a place you wouldn't normally be. Because what is the worst place to worry? Worst time to worry? In bed, right? what a cruel trick that your brain plays on you when you're in a situation where you absolutely can't do anything about it,
Right.
right? So here we are, we're trying to get to sleep and we're worrying about our children and worrying about our job and worrying about our partner and so on. So one of the things is that you find a place to worry, meaning a place that you don't normally, reside. So maybe it's out on your front porch, or maybe it's next to your refrigerator, or maybe it's next to your kitchen sink, or wherever. And that's going to be your worry place. And so here you are at night trying to go to sleep, and you're saying to yourself all these worry things. You say, wait a minute, I'm not in my worry place, and I'll worry about this later. In a way, you're talking back to your brain, right? And then third thing is you go through your list and then say, and then figure out what things can I do something about, right? Is there something I need to say to my child or my spouse or my mother, about my worries about them? Is there something online? Is there a video I need to watch? Is there a book I need to read? Whatever it is, find ways to do something about the worries. But then as you go through your list, you're going to realize that some of these worries you can't do anything about. We as humans, like control. We like some degree of control in our lives. And so I'm sure most people who are watching this have heard of the serenity prayer,
Yes.
where you sort out what you can do something about and what you can't do something about. And then your job is, and this is the hard part, the really hard part, to let go of the things that you can't do anything about. And I say that especially parents who are worried about their children in their grief, is that your kids, no matter how old they are, at 5 years old or 15 or 35, they're going to grieve how they're going to grieve. Okay. And like I say, they're not going to tell you everything about, how they're grieving. Maybe they're crying at night, missing their brother or sister, or their grandmother or whatever. And so let them and have some faith in the fact that they're going to find a way. Let's say here's a 15-year-old girl whose older brother died. And here she is at school walking down the hallway, and no kid wants to be that kid who's, oh, look, her brother died, but maybe a week later she's talking to someone in the cafeteria, and that person says, Sarah, her brother died last year. Maybe you should talk to her about it. And then, without your knowledge as parents, suddenly these two girls who maybe didn't have a lot in common can talk about, does your mom do that? Yeah, my dad do that. And right. And so, they're going to find a way, or they read a book, or they do something online, and they watch something that's going to help them cope with their grief. And so we have to some degree, have some faith. But proxy grief is there. We're in our own grief about how they're grieving, but you have to write down what those worries are, sort it out. Is there something you can do about it? Then say it, do it, text it, email it, write a letter. One of the best ways to talk to a kid, especially a teenager, about something difficult is to do it in the car while you're going someplace, where you're both staring straight ahead, because they don't want to look at your face or whatever. And so, and what the kid also knows is that in 15 minutes this car ride is going to be over, and they'll be able to escape from this, right? But in the meantime, here you are driving along, and you have this question to ask the question. Okay, so those are some of the ways to consider how to deal with this proxy grief thing.
It sounds like a good way to handle a lot of things that we worry about, whether it's related to grief or not.
Yeah.
So you've really helped people in a lot of ways just by giving us that much information. So I've experienced this myself. I know many people have experienced it. The reason that I'm doing this series is because of it's a 10th anniversary of the death of my daughter-in-law. And so my grandchildren lost their mom, my son lost his wife, um, and now 10 years later, we're back to being sort of having a normal, calmer, happier way of living. And so the children were were children when I got here and stepped in to help them. And I remember just something you said now. One of them said to me, "You don't cry much, do you?" And
Mm,
little did he know. Um,
yeah.
yeah, I didn't cry in front of them, but yeah, at night and worried for them and for, the family and for the extended family. So worry does become like a constant companion sometimes. This is so interesting and so helpful. Should I ask you something that I didn't ask you about this that we should know? Tell me. What would
Oh,
you?
there's something you didn't ask?
Yeah.
Well, one of the things is to give, especially your children, permission to grieve how they're going to grieve. A good question to ask a young person of any age, a 5-year-old, a 15-year-old, especially not long after someone dies, is the following question that I've found very helpful. Here you are, again, you're in the car, you're driving along, and you say, sometimes when someone dies, like grandpa, sometimes we might think it's something we said or did or didn't do. Did you ever feel that way? And then do what every good counselor does: shut up. Okay. Just wait for a response, because, kids have what's called magical thinking. They think something they said or did or whatever, and then this terrible thing happens. They're always looking for, some connections. I taught the course on death for more than 40 years, and my students had to keep a journal that they turned in 3 times during the course of the quarter. And so I got many stories of, here's a 25-year-old student who's looking back at her childhood, when she was 6, 7 years old, when her father died in a car accident. And, back then she thought that her negative thoughts toward her father, because her father was the disciplinarian, caused the death to occur. And what she needed back then, she realized, was someone to sit down and ask that question and to help them understand that, yes, you may have had these thoughts and dad died, but these thoughts didn't cause it. How did dad die again? He died in a car accident, and it wasn't your fault. And especially teenagers, they have uh, sometimes what are called superstitious behaviors, which means that an event occurs and then another event occurs, and we think somehow event A causes event B. I
Mm.
give them my example in class where I'm lecturing away, and all of a sudden I sneeze and the lights go out, right? And for the moment, it's like, wow, his sneeze, that's a superstitious belief. Event A, must have came before event B, and it must have caused event B. And so again, for teenagers, I have these thoughts, or I did this terrible thing. I stole something, and my sister died a week later, or I engage in masturbation, or I swore, or I did this thing, and then this terrible thing happened. Somehow, maybe I caused it. Here's a 16-year-old boy, and he likes this girl at school, and he's got this basketball and he's bouncing around. And then he comes up with this idea: if I make this shot, she likes me. Okay, all right, I missed. All right, 2 out of 3, right? Okay. And so what's going on here? That kid is smart. He knows the difference between that ball and that girl, but he's trying to, somehow have this connection. And so that's what they do. They come up with these superstitious behaviors. And it's a good question to ask, have you ever thought, that maybe something you said or did or didn't say, or, grandma died and I didn't go visit her the last time at the hospital. And, maybe she got so sad, maybe that's why she died. Right. So exploring those kinds of things with especially young people is important.
That's very important that you say that. And in all the years of practice, I can tell you that it's not just children that have that magical thinking too. So it's important for people to have someone to talk to and help
Yeah.
them sort those things out and try to make sense of what's real and what isn't real. And sometimes I think grief, in my experience with some of the people that I worked with, it does sort of tip them over the edge into some kind of really I don't know what the word would be that would be acceptable nowadays, but it seems like maladaptive coping. And so that's a good thing to look for and to watch for in both children and adults.
Yeah, yeah,
Yeah.
good
Thank
point.
you so much for that. I really have enjoyed talking to you today, and I do hope that you'll come back and talk to us about some other aspect of grief. We have 30 days in April, but we're filling up the calendar with all different kinds of topics. And I have a sense that some of these are really going to resonate with people, and that they'll want to ask you questions and see you come back again. Would you be willing to do that?
Oh, sure,
Oh,
sure. Also, let me mention that several months ago, I started posting 2 and 3 minute videos on Instagram.
okay.
And so every day there's a video, usually about issues coping with grief and loss and so on. So right now I think I have more than 250 videos that people can click on. And the great thing about Instagram is your videos cannot be longer than 3 minutes. Yeah, yeah. So I have to, get this. For example, I yesterday posted a couple videos that aren't going to be for another month on issues relating to homicide, for example. So, homicide, suicide, accidents, guilt, anger, confusion, all these things. And another one was on euthanasia and doctor-assisted suicide and all these kinds of issues. So,
Oh my goodness, you cover the
yeah.
whole gamut, don't you?
Yeah, I'm really well, I really miss teaching. I taught for 50 years and, everyone knew my favorite class was the death class. And so well, I retired 2 years ago and then I got involved with this Instagram and it feels like I'm teaching again. So that's fun.
Well, I will definitely put the link to your Instagram account down below with your bio and other links that you've provided for people that and ways for them to be able to connect with your work.
Great.
Thank you so much for being here today. And I'm going to say bye for now, and hopefully you'll be back.
Good. All right, Patricia, take care.
Thank you.
Thanks for all you do. All
Thank
right.
you.